COVID and heart disease, it's a very bad combination. COVID in general actually causes diseases of the lung. Your lung fills up with a lot of germs, fills up with a lot of enzymes, and that can cause breakdown of your lungs. Essentially, your lungs will fail to function. However, the second commonest cause of death in COVID patients is actually due to heart failure, due to the COVID affecting the way the heart works, and the heart essentially is a pump and it moves the blood around your body. On average, the heart should pump about 4 to 4.5 liters every minute. But if you have heart failure, it might pump only 2 to 2.5 liters per minute. And if you have COVID, this number might drop further and further to the point that your heart fails to pump the blood around, and you can actually develop other complications which will then lead to death. So, with or without COVID, if you have heart disease, it is still a very high cause of death amongst the general population. There's never an age where you're too young to worry about heart disease, but as a rule of thumb, by your 35th birthday, you should actually go and have a checkup for your heart.
And how do you recommend for the checkup to be done?
So, to check the heart, it's usually quite tricky. The heart is an internal organ, means it's deep inside. From the skin, you have to go below the muscle, below the ribs, which are bones, below the lungs, then only you get to the heart. So, assessing the heart from the outside is actually not very accurate. One of the ways to check the heart accurately is to do an exercise stress test or a treadmill test. So what we do is we actually attach some leads and some monitors to you onto your skin. It's just stickers, no injections. There's no radiation involved and no medicine involved. But you will need to run on a treadmill. So a treadmill is like those exercise machines you see in the gym, where you get on it and it moves and you have to run on it. So you will go faster and faster, and all these little monitors will monitor your heart rate, will monitor your blood pressure, and monitor a tracing of your heart activity. And from there, doctors can actually come to a conclusion with about 80% accuracy whether there is possible blockage in your heart or not. Many patients have never had symptoms, never had chest pain, never had any problems. They come for checkup and their stress test reveals that they have blockage. And we dealt with it. We dealt with the blockage before they got a heart attack, so we prevented the heart attack in those patients. On average, we actually see about 10 to 20 of those patients every week.